In this podcast episode, Dr. Paul Conti delves into the intricate relationship between mental health and physical well-being, revealing how unresolved trauma and mental distress often manifest as physical symptoms. He emphasizes the importance of compassionate self-inquiry, the role of generative drives in human behavior, and the limitations of current mental health practices, including over-reliance on medication and the challenges posed by AI in therapy. Throughout the conversation, Dr. Conti presents a powerful framework for understanding and optimizing mental health by shifting the focus from what is wrong toward what is going right. Dr. Conti begins by highlighting that more than half of all complaints presented to physical medicine doctors often originate from the mind. Conditions such as increased pain, gastrointestinal issues, fibromyalgia, autoimmune phenomena, and rashes, though seemingly unrelated, can stem from a common mental health origin. He reveals that the mind and body are not just connected, but are deeply interwoven, with stress and anxiety directly impacting immune function, inflammation, and overall physical health. This integrated perspective challenges the traditional siloed approach in medicine, where mental and physical symptoms are treated separately, often missing the root cause. A critical point Dr. Conti raises is the mental health field's fixation on symptom labeling and diagnosis, epitomized by the DSM, Diagnostic and Statistical Manual of Mental Disorders. While the DSM catalogs symptoms extensively, it offers little guidance on understanding the origins of distress or pathways to meaningful change. This symptom-focused, taxonomy-driven approach often leads to overdiagnosis and medication prescriptions that treat symptoms without addressing underlying causes. As a result, many patients remain trapped in cycles of worsening mental and physical health without a clear route to recovery. Dr. Conti advocates a paradigm shift away from the prevailing "what's wrong" narrative and towards a framework of exploring what's going right. This perspective acknowledges human resilience, perseverance, and inherent capacities for growth. He argues that many people settle for feeling merely fine, which he describes as the enemy of inquiry and improvement. Fine often masks untreated underlying issues and prevents deeper reflection or healing. Embracing curiosity and compassion toward ourselves can unlock the ability to understand life patterns and begin transforming them. A poignant part of Dr. Conti's story involves the traumatic death of his youngest brother by suicide. He shares how this personal tragedy plunged him into hopelessness, marked by unhealthy relationships, increased substance use, and profound shame, a common human experience when trauma remains unprocessed. Unlike grief, which is a healthy response to trauma, unresolved trauma can embed itself deeply, manifesting in guilt, shame, anger, and fear that block healing. Without compassionate inquiry and therapeutic help, these traumas can accelerate biological aging and contribute to both mental and physical illness, sometimes even across generations through epigenetic changes. Dr. Conti explains the concept of intergenerational trauma, how the traumatic experiences of previous generations can alter genetic expression and be passed down, influencing descendants' anxiety levels and stress responses. He gives the example of children and grandchildren of Holocaust survivors who manifest anxiety and fear even when unaware of the original trauma. Understanding this heritable biological impact underscores the critical importance of addressing trauma not only for oneself, but to prevent perpetuating its effects through families and communities. Addressing the resistance patients often feel when confronted with the idea that their physical symptoms originate in mental health, Dr. Conti recognizes the stigma embedded in this perspective. He says it is essential to reframe mental health distress as a legitimate part of overall medicine, not as all in your head or a sign of weakness. When multiple seemingly unrelated symptoms cluster in one person, it typically points to a shared underlying mental health cause. Patients often feel relief when told that these disparate symptoms may have one source because it offers a path to healing rather than confusion or fragmentation. Dr. Conti describes a holistic model where just as our bodies have anatomical structures and physiological functions, our minds have analogous structures of self and functions of self. Healing requires a thorough inquiry into these elements, much like a doctor would examine history, perform a physical exam, and order tests for bodily ailments. Through this methodical exploration combined with compassionate curiosity, individuals gain insight into imbalances and root causes, enabling effective interventions and fostering empowerment, agency, humility, and ultimately happiness. Shifting to human motivation, Dr. Conti challenges the outdated psychological notion that human behavior is primarily driven by aggression and pleasure. Instead, he introduces a triadic framework including assertion, the drive to assert oneself, pleasure, gratification, and comfort, and a higher generative drive. The generative drive represents humanity's intrinsic desire to contribute, create, nurture others, and seek meaning beyond self-interest. It explains acts of kindness, creativity, and sacrifice that cannot be reduced to mere pursuit of pleasure or self-assertion. This drive is fundamental to mental health and the experience of happiness. Happiness, according to Dr. Conti, consists of three experiential qualities: peace, a mind free from incessant negative thought; contentment, acceptance of one's life narrative with gratitude; and the capacity for delight, the ability to find joy and awe in the world. He emphasizes that cultivating happiness requires balancing the three drives, with the generative drive anchoring one's purpose. People often mistake external achievements or material gain as sources of happiness, but true well-being arises from meaningfully integrating assertion, pleasure, and generativity. Dr. Conti addresses the difficulties people face when trauma is deep-seated or relationships are unhealthy, such as those involving narcissism. He stresses that these patterns often stem from early life experiences, for example, repeating dynamics with unpleasant figures modeled by parents, leaving individuals stuck in harmful repetitions. Healing requires understanding these patterns without self-blame and making difficult but necessary changes to break cycles. Although daunting, with insight and support, people can reclaim agency and seek healthier connections. Throughout the conversation, Dr. Conti asserts that science alone cannot answer all questions of human experience. While scientific tools reveal much about brain function and epigenetics, they also unveil the profound mystery that underlies existence. He encourages embracing this mystery, which can foster awe and spiritual connectedness beyond reductionist explanations. This openness to something greater harmonizes with and supports the generative drive, enriching mental health and flourishing. Dr. Conti critiques the common over-reliance on pharmacological interventions, particularly SSRIs, in mental health care. While medications have important roles, such as treating bipolar disorder or supporting depression treatment, they often serve as a band-aid when prescribed without deeper inquiry. The brevity of typical doctor visits exacerbates this problem, with limited time for nuanced understanding, leading to symptom-focused prescriptions. He advocates a model where medication is adjunctive and used alongside a comprehensive process addressing root causes and fostering change. The discussion touches on the emerging trend of individuals turning to AI for companionship and therapeutic advice. Dr. Conti warns that although AI can offer rapid information processing and ostensibly empathetic responses, it lacks genuine intelligence, consciousness, and a generative drive. AI's tendency to reinforce existing beliefs without true understanding can mislead users, fostering dependence on artificial relationships that cannot meet deep human needs for authentic connection, challenge, and emotional growth. At the heart of Dr. Conti's message is cultivating compassionate curiosity toward one's recurring thoughts and internal dialogue. Recognizing harmful self-talk, such as persistent beliefs of unworthiness or failure, as arising from past programming rather than objective truth opens a path to healing. He highlights that shifting from harsh self-judgment toward an inquisitive, gentle stance toward these thoughts provides new perspectives and begins to unravel destructive cycles without self-blame or avoidance. The book Dr. Conti authored offers a roadmap for individuals to engage in this process of inquiry and transformation independently or alongside professional support. It includes exercises to explore early life narratives, identify dysfunctional thought patterns, and balance the drives, all through a lens of kindness and hope. This accessible approach empowers people who may not have immediate access to clinical resources, affirming that mental health can be understood and improved by anyone willing to embark on this journey. Dr. Conti draws attention to the pervasive nature of destructive internal voices that can feel even harsher than external criticism. He urges listeners to recognize that this inner voice is not the totality of the self, but a learned pattern that needs examination. Treating this self-abuse as unacceptable and bringing awareness to its origins provides a crucial turning point. Unlike external abusers, this voice resides within and is often unchallenged. Shining light on it offers liberation and a foundation for self-compassion. Ultimately, Dr. Conti reminds listeners that the challenges of mental health are universal and not signs of personal failure. The human mind may feel isolated under the weight of painful thoughts and emotions, but understanding the mechanisms behind these experiences builds solidarity and hope. Recognizing that mental health struggles emerge from human survival adaptations and programming invites gentleness toward oneself and opens doors to meaningful change and connection.